A very warm welcome, everyone. I, Dr. Ritika Dhiman, on behalf of Voice of Healthcare, welcomes all the speakers and the viewers who have joined in for a panel discussion. Voice of Healthcare, along with our powered by partner Manipal Hospitals, has taken an initiative to bring together the experts and speakers to discuss on elevating surgical excellence with robotic surgery. Today, we gather to explore the transformative role of robotic surgery in advancing the field of medicine and its potential to revolutionize surgical procedures. In recent years, we have witnessed remarkable advancements in robotic technology, enabling surgeons to perform complex operations with enhanced precision, improved dexterity, and reduced invasiveness. Our esteemed panelists, who are pioneers in the field of robotic surgery, will share their experiences, expertise, and insights into this rapidly evolving discipline. So, without further ado, let's get started with the introduction of our esteemed panelist. I welcome Dr. Rajashekhar C. Jaka, consultant surgical oncology and robotic surgery, Manipal Hospital, Whitefield. Welcome, Dr. Jaka.
Sir, you are muted. Mute.
Hi, thank you so much.
Dr. Manjunath Haridas, consultant general laparoscopic, colorectal, and minimal access surgery, Manipal Hospital, Whitefield. Welcome, Dr. Haridas.
Thank you very much. Nice to be here.
Dr. Deepak Jayaprakash Kaddu, consultant urology and robotic renal transplantation, Manipal Hospital, Whitefield. Welcome, Dr. Jayaprakash.
Thank you, Ritika.
Dr.
Thank you,
Sumit
everyone.
Talwar, consultant general laparoscopic and minimal access surgery, bariatric surgery, Manipal Hospital, Whitefield. Welcome, Dr. Talwar.
Thank you, Dr. Ritika. It's a pleasure to be here.
So, starting with this discussion, I would like to put forward to all the speakers, starting with Dr. Manjunath, how has the integration of robotics transformed healthcare over the last 10 years, and how do you envision the future of robotics in healthcare?
Thank you very much for having me here today. This is a very important question to start off with. I mean, before I actually start entering into the question, I think there are a couple of important points that we should consider before even getting into what robotics has done for surgery. Now, if you look at the total landscape, I mean, the laparoscopic surgeries are almost closer to 14 to 13 million surgeries per year in the worldwide. If you break that number down to Indian population, I mean, we are one of the world's highest populated place in the world, and we perform closer to around 3,000 to 4,000 surgeries per 1 lakh population. That is probably a little bit lesser in number. Now, if you actually break that number down even more, I mean, robotics is just probably around 20,000 surgeries per year, and this is coming from the last year's data itself. So, if you look at really the laparoscopic surgery at the initial introduction in the 1980s, it changed the landmark about laparoscopic surgeries performed. It changed the way that we look at diseases, it changed the way we treat diseases, and ultimately the patient outcome became far better from the conventional surgery. So, I think in robotic surgery itself, in terms of what we are looking for, in terms of patient outcomes, things are starting to change with the introduction of robotic surgery in the 2000, probably around the 2000 by the Da Vinci themselves. I think the number of surgeries that have been performed started to increase in the urology and the surgical oncology section. And slowly we started to realize that patients are far superiorly getting better in terms of their outcome, in terms of their recovery, and the disease as well was better controlled. And if you look at the laparoscopic surgeries, compared to the robotic surgeries, robotic surgery was able to give one upper hand more than what the laparoscopic surgeries would do what robotic surgery would do for the patient's recovery. And this has improved significantly in the patient outcome. And I think we have almost closer to a decade or more than a decade of experience using robotic surgery in treating patients. And I think right now the expert would be towards robotic surgery themselves. I think that is where we should actually look at trying to improve and enhance robotic surgeries in the near coming future.
Right. Thank you so much, Dr. Manjunath. Moving on to Dr. Deepak, sir.
So I would like to, as sir has spoken, so world is slowly moving towards from laparoscopy to robotic and making it more and more minimal invasive and more patient and doctor comfort. So this how the robotic is improving and how it is revolutionizing the healthcare in India. So if you take the number of surgeries happening in USA, so in the minimal invasive section, like compared to the laparoscopic robotic, so more number of surgeries they are doing by robotic, and the laparoscopy number is less because the patient awareness is more. They have a lot of insurance coverage for the healthcare, so it is very easy to get to robot, and most of the hospitals having the robot, the maintenance is for them. It is easier to maintain with whatever healthcare facilities they have got. So it will slowly the trend in India will also change. So I was discussing with one of the robotic companies, their people, the engineers. So they were telling that what they were selling in 1 year, like 2 3 years back, the products they were selling, robot where they're selling, they are selling almost 5 to 10 times in 1 quarter. So this is how the revolution is happening. So we are getting more and more robots in our health system, and slowly, once the health insurance coverage becomes more and more widespread, and the people are accessible to health insurance, they will not care whether laparoscopy is less expensive and robotic is more expensive, because insurance is covering it. So they will go for the best treatment available, which is the robotic. So in the minimal invasive section, definitely the robotic is going to revolutionize. And also, if you take like in the recent perspective, many of the surgeons, like in when I finished my MCH, it was like almost I have done many things, and the robot was, I have not learned robot, but after some time, after in being in private practice, I got the training of robot. But now the even the older generation of surgeons, they are dying to learn the robot, because they know the future is robot, and learning a robot is almost like a must training. It is thought like in subspecialty that robot is an subspecialty, but here onwards I think you need to have a robotic training as an additional training, because you might encounter any difficulty. You need to have the robotic access, and you should have robotic knowledge while operating the patients. And of course, if the doc because robot has the best vision, the best dexterity, and the surgeon is at very much comfort. So if the surgeon is at very much comfort, the results are of course at the superior level. And the learning curve is so less as compared to the laparoscopy. The more and more people are learning in very fast, the trend, and soon India will be leading in robotic surgeries, whether it is in number or in quality. I think so. Yeah.
Right. Thank you so much, Dr. Deepak. Moving on to Dr. Rajashekhar, sir.
Yeah, I think most of the points are already enumerated. I would say with only one sentence that it is the future. Robot is going to be the future technology through which we are going to do surgeries, majority of the surgeries. Though we have begun with few surgeries, mostly in future, majority will be done by robot. Uh, as simple because patient care is better, so surgeon comfort is better, so surgery is performed in a better way. So definitely this is the future, which has really made lot of difference in the outcome of patient care. And cost wise, yes, it's a new technology, very standard technology, so that is why now cost is high, but over a period of time it is going to become very less. And every small hospital setup, small nursing home will have robo in future. So I would say just one word, that it is the future of surgery. That's all. Thank you.
Thank you so much, Dr. Rajashekhar. Moving on to Dr. Talwar, sir. We would like to add something to that.
Dr. Rajashekhar Jaka just stole my lines. So, so I believe everything has been covered. Just reiterating a couple of things. One is that I remember when laparoscopy was introduced, it was also met with the same skepticism as the robot is being met with even today and a long time back. The cost of laparoscopy has gone down tremendously, and the laparoscopic equipment is now available in all OTs. If you want me to say it like that, it is available in all OTs, and ultimately, I see in about 10 years that in all big hospitals, all OTs will have robots. Um, in smaller hospitals, in another 10 years, everywhere the robot will be available. And everything that we are doing laparoscopically, well, not everything, but quite a few things that we are doing laparoscopically will be shifting over to the robot. Whatever we could do open, we have done everything laparoscopically, and of course, shifting over to the robot is like a piece of cake, and it is even simpler and better. So that is how it is going to be.
Thank you so much, Dr. Talwar. I think all the speakers have rightly said that once we transform from open surgeries to lab surgeries easily, so I think it will also be the future of healthcare surgeries, basically the surgeries that we do on patients. So we have moved from open to lab, and now we are moving from lab surgeries to robotic surgeries. So yeah, so that is what I'll take from all the speakers what just said. And now moving on to Dr. Manjunath, sir, can you please share examples of some challenging GI surgeries where robotic assistant has been particularly beneficial? And how does robotics contribute to improved patient outcomes and reduced complication rates or more efficient surgical procedures?
When very recently, I can actually quote two examples where I really thought that if I had the robot, it would have been very helpful. Now, one was just yesterday, I did a total gastrectomy, and I can tell you, just off the back of the experience, initially when I had done gastrectomy with robotic surgery, it was a breeze, and it would take some time, but was able to complete it within normal limits. And the anastomosis was not that difficult as well. I mean, if you had any problems with any kind of a stapling device or anything at all, you could just go ahead and sew it. I mean, that is how instinctively you can just make decisions and you can go ahead and change the patient outcome. Now, yesterday's laparoscopic total gastrectomy had to be done because of patient financial issues. But the amount of stress and the amount of difficulty that I had to go through trying to make sure that the outcome is better, and ultimately we didn't have a stapling device that could have been potentially done a good staple of the remnant of the esophagus and the jejunum was not there, and we had to improvise a little bit different kind of an anastomosis that may have compromised. I hope it doesn't, but at the end of the day, it makes you a little bit uncomfortable because you really want to do the best that is possible for every patient outcome. The robotic surgery gives you those options, and this is just one example. I mean, just 2 weeks back, I did a very large complex hernia on a very young woman, and she I dreaded trying to get things back with laparoscopic surgery. If I had that robotic with me, and if she had agreed for the robotic surgery at that time, and I can still say that that patient outcome would have been far better than what it would have been now. So these are just few examples where you can really bring it down and say, you know what, I wish I had that. And I think at Manipal, Whitefield right now, we should shy away from saying that I wish I had that. And I would like to make all the patients who are actually watching this, make them aware that, you know what, if maybe if you have any problem that needs to be addressed, and if you think you can find any kind of a surgery, what I would recommend them is choose robotic surgery. I mean, we are there and we have the top notch robot in our facility, and you should probably look at trying to get a better outcome by using those facilities that are available. And these are just few examples. I'm pretty much sure each one of us have examples of such over a period of decade where we can just keep on going, and we will not even have time to finish this. But I think these recent two examples really pinched me, saying that I wish I could have convinced the patient a little bit more and would have given them a better outcome. So these are my 2 cents about how robotic surgery I could have used in the recent past.
Thank you so much, Dr. Manjunath. I would like to congratulate Manipal for taking a leap ahead, a step further into the robotic surgery. And thank you so much for sharing your experiences with the surgeries that you have done with the help of robotics and the GI surgeries, basically. And moving on to Dr. Rajashekhar. So, sir, we talked about GI surgeries. So, what do you think are the specific challenges and complexities involved with cancer, and how does the robotic approach address these challenges?
See, as such, the advantage of minimally invasive surgery, what we say, that is definitely there with the robo. Beyond that is the precision. What we have a bigger advantage in this, because as far as onco is concerned, means cancer is concerned, the margin status and also preserving the or reducing the collateral damage is also very important. Because, for example, in case of cancer of the rectum, it is as important to preserve the sphincter, also to preserve the nerves, so that side effects are less. So I would say the when you have to dissect in the planes, the right planes, only then you will be able to get a negative margin, and also tumor chances of tumor coming back becomes less. Otherwise, anyone can resect a tumor, but if it is dissected in a proper plane and if negative margin is achieved, then chances of it coming back becomes less. So patient can survive for a longer time. So that is how it is. Like negative planes of dissection are good. Deeper into the pelvis, sometimes it is very difficult to see through the laparoscope. And similarly in thorax, it is so difficult to manipulate because of the cavity structure is like that, that we will not be able to bend the instrument so much. So in the robo, we don't have that problem because it's an endo-rich technology. We will be able to access any part of the thorax with this. So like this, there are a lot of advantages. And sometimes in the rectum, intersphincter dissection or tumor is very close to the sphincter, even then we will be able to go near the pelvic diaphragm and do it. So all these things are possible. So in that way, it gives a better outcome. Surgeon will have a better comfort to dissect in a complicated area, and also can give a better outcome to the patient. In this way, definitely it is a lot better.
Rightly said, Dr. Rajashekhar. We need precisions so that cancer don't reoccur. So thank you so much for giving those insights. Moving on to Dr. Deepak, sir, what are the key benefits that patient experience with robotic surgery as compared to the other surgical open and lab procedures, and how it enhances patient safety, minimize complication, or improve post-operative recovery?
Yeah, so I would like to give my urology perspective in this, how the it is safer for patient and better outcomes for the patients. So the most commonly done surgery is radical prostatectomy in urology by the robot. So in robotic assisted radical prostatectomy, we are operating in a pelvic cavity, which is a very narrow cavity. So to reach that cavity, the laparoscope is very difficult. Means we can reach, but the anastomosis and the assistant part becomes very difficult. The suturing becomes difficult. But if you go for the open, it's the going the hands there and doing the suturing is another difficult level. So for robotic, it's quite easy. You can reach your camera wherever you want, and a surgeon can shift his camera on his own. And the suturing, the dexterity is so excellent. The suturing becomes very easy. And as Rajashekhar Jaka sir told, you can see the minute structure, so you can preserve the nerves and you can preserve the minute vessels which could have been damaged if you do by laparoscopy or open, and that can cause bleeding and complications. So you can definitely save the patient from complications. You can give better results because you are preserving the nerve. So the continence in a post-RRP patient is excellent, and as the suturing is good, so the urine flow is also good, and the erection is also good because the nerves are preserved. And the most important thing, the oncological safety margins. As you are removing the tumor in entirety with the robotic excellent vision, you are giving the best oncological result. So another surgeries we do is robotic partial nephrectomy, which is most of the things are possible by robotic. People do by laparoscopy, but it's very easier to do by robotic. And again, the oncological safety margin, preventing the complications like urine leak or pseudoaneurysm or bleeding. So there are some other surgeries which are not looked into by robotic. I would like to give example is we do video endoscopic inguinal lymph node dissection. Previously, people used to do by open, and in which you create a flap, and then the patient. This is in terms of CA penis having the groin lymph node. So the patient keeps the drain for longer time. But when you do the dissection with the robotic method with the wheel, the patient just the drain is removed on the fourth or fifth day. And even in terms of robotic assisted IVC thrombectomy, we have to make around 30, 30 centimeter wide incision to take better vascular control when we are operating a renal cancer with the IVC thrombus. But when you do by robot, you can easily, with the minimal access, you can prevent the larger incision. So the patient suffering is decreased. So the patient can recover from a major surgery quite fast. This robotic assisted IVC thrombectomy, if you do by open method, the patient might succumb to the big incision and the comorbidities related to it. So these are some of the urological surgeries we do by robotic. So one thing is the dexterity, because the suturing is very clear because of the dexterity, then the excellent vision and the assistant, you need not depend on anyone else. The doctor himself can move the camera and the assistant ports. And the most important thing I would like to speak again, that if you are driving to some place, if your driver is at the most comfort, that is your surgeon is at most comfort, then your journey will be excellent. Like you will reach the destination fast and safe way. So the surgery will be the best. So the outcomes will be the best if the surgeon is at comfort. So the patient benefits will be earlier recovery and lesser complications, as I mentioned, and the cosmesis and the pain is less. All those with the minimal access surgery. So these are the doctor and patient benefits from urology point of view for the robot. Thank you.
Thank you so much, Dr. Deepak. I think you have told us about most of the important surgeries that are done in urology and the benefits of it for the patient as well as the doctor. It also, I think, reduces the physician burnout and the long surgery hours as well. And yeah, so moving on to Dr. Sumit. So we have talked about GI surgeries, urologic surgeries, cancer. What specific advantage does robotic surgery offer in bariatric procedures? And how does it enhance patient outcomes as compared to the lab techniques that we are currently doing?
So here we are talking about patients who are 2 or 3 times the normal body weight. So their abdominal wall, the amount of fat under the skin and is so huge that when we operate with laparoscopic instruments, there is a lot of torque that comes to my hands and to my shoulders. So as a result, what happens is that the dexterity that I need at the end of my instruments is reduced. Second thing is the abdominal wall is so heavy that the insufflation pressures have to be kept high, and that in turn leads to a lot of problems in the patient circulation and maintenance of the blood pressure and all. So when we are using the robot to perform a bariatric surgery, which is a complex GI operation being done in a relatively small constricted space, we use two of its uh, important attributes. One is that since the instruments have an endorest movement and they can move in various directions, we can reach difficult corners with robotic instruments, in which we have to struggle when we are doing when I'm using a laparoscope. The second thing that we as bariatric surgeons use most often is something which is called a robolift. The robotic arm is used to lift the abdominal wall and stabilize it there. That is one of the attributes of the robot that we use. So, since we can lift the abdominal wall and stabilize it there, it doesn't transmit the burden to my shoulders. I can use it fat under the skin and is so huge that when we operate with laparoscopic instruments, there is a lot of torque that comes to my hands and to my shoulders. So as a result, what happens is that the dexterity that I need at the end of my instruments is reduced. Second thing is the abdominal wall is so heavy that the insufflation pressures have to be kept high, and that in turn leads to a lot of problems in the patient circulation and maintenance of the blood pressure and all. So in the when we are using the robot to perform a bariatric surgery, which is a complex GI operation being done in a relatively small constricted space, we use two of its uh, important attributes. One is that since the instruments have an endorest movement and they can move in various directions, we can reach difficult corners with robotic instruments, which we have to struggle when we are doing when I'm using a laparoscope. The second thing that we as bariatric surgeons use most often is something which is called a robolift. The robotic arm is used to lift the abdominal wall and stabilize it there. That is one of the attributes of the robot that we use. So, since we can lift the abdominal wall and stabilize it there, it doesn't transmit the burden to my shoulders. I can use it
Welcome to the
of